Lateral bending, rotation of the thoracic spine.
Okay, lateral bending and rotation of the thoracic spine in a prone position. Classically for the examination, we're going to be using a mid-thoracic spine. It's probably going to be either T7 or T8. Taking a look at the facet planes of the thoracic spine, they're 60 degrees to the transverse plane, 20 degrees to the coronal plane. Rotation, in essence, happens along this coronal plane. Lateral bending occurs along the 60-degree plane. It's the easier way to think about things. So I'm first going to assess rotation of the thoracic spine. In the lumbar spine, we stood to the side of the movement. The thoracic spine doesn't make a difference. You can stand to either or side. You can equally assess both rotation and lateral bending. So the thoracic spine, stand whatever side you feel more favorable towards. I'm going to assess, in this case, left rotation of the thoracic spine. Your two segmental contact points in the thoracic spine are going to be the spinous process or the TVP. Your line of drive, if you choose the spinous process, is going to be from lateral to medial, in this case from left to right. And in order to induce left rotation of the thoracic spine, my contact of the TVP would want to be on the right TVP, and I would want to press P to A. So anatomically locating your segmental contact point, used in class, I find the inferior angles of the scapula and I bisect that. That puts me on the spinous process of T7. So if I wanted to assess left rotation, I'm at the spinous process of T7. All I have to do is come to the lateral aspect of that spinous process, and I can use a thumb or a reinforced thumb. I'm going to get in that lateral to medial drive. I'm going to lean my body weight in, and you're going to feel that spinous is going to drift, and then quickly it's going to give you back pressure. That's pretension. And then from there, I'm going to spring lightly from lateral to medial, from left to right. Another contact, if you choose to use a TVP, the only thing is finding that TVP in the thoracic spine. We know that once we find the spinous process, it's 2 inner spaces up and then over to the right side approximately about an inch. If you like, you could do what Dr. Brownie did, and first you can confirm that you're on the TVP by pushing P to A until you can feel the wagging of the spinous. Once you locate that, good doctor's positioning would be, 1, we could just spring straight P to A on this TVP, getting your body weight up over. Let your body weight fall into your hand contact. You'll quickly feel pretension. From there, let your body weight lightly drift through there to feel that 1/8 of an inch of the resiliency of that joint. Another contact, segmental contact points and contacts you could use. Some people like to both push P to A on the TVP and lateral to medial on the spinous. Some people, like the lumbar spine, they like to feel the relative movement between one segment and the other. And the easiest way to do this is, once you know where the TVP is, with, let's say, your superior hand, contact the TVP. With your other hand, find the spinous process, and then just drop inferiorly into the inner spinous space. This way, when you get over and press on the TVP, we're going to feel both joint play and end play. As you push on this TVP, you can probably even see it here, I should feel the spinuses separate. When they're really locked up, as you push on the TVP, you'll feel the two will rotate as a team together. That implies probably that end feel is going to be restricted as well. So to feel end feel, I bring the joint to pretension, and then I lightly spring through it 1/8 of an inch. In a normal moving joint, you should feel a little bit of more separation. In a restricted joint, you may feel little to none, and the two may still travel as a team. In this case, if that's what I found here, this would be a left rotation restriction, in this case of T7. Lateral bending. Lateral bending occurs along that 60 degree off the transverse plane. We can kind of look almost as if we're trying to take a segment and we're trying to twist or torque it. This way, to be within the planes of the facets, I'm going to cause, in this case, I'm going to go into left lateral bending. So I want to cause this counterclockwise type of a torque or movement in the counterclockwise direction. Using the TVPs as our contacts, we have to look at saying, okay, what motions do you have to do on the left side and also the right side? Because we're going to use those simultaneously. Well, if I want to create this counterclockwise torque, my line of drive on the left-hand side is going to be P to A, S to I, and technically from lateral to medial. My contact on the right-hand side is going to be P to A, I to S, and lateral to medial. Now you can also say P to A, S to I to S with a counterclockwise torque. That's matter of fact, to tell you the truth, that's probably a little bit easier. Either which way, these are the lines of drive I want to go into my segmental contact points. To this end, with this particular maneuver, of the two arms I have, for the left side, my superior hand, in this case my left hand, has a natural inclination to go S to I. So it's the hand of choice to use on this side. Similarly, on this side, where I want to come I to S, my inferior hand has a natural inclination to go in the I to S plane, so I'll tend to use it. So again, superior hand on the left side, inferior hand on the right side. We're going to create left lateral bending. My apologies. The only other thing you have to take count of is anatomically we know how to find these TVPs. But because we're going to be coming S to I and I to S, we also have to take into account tissue pull. So we generally take tissue pull or tissue slack in whatever our line of drive is going to be. So being that I know I'm going to come S to I on this side, this is where the TVP is. I'm going to want to come a little higher or slightly superior to this so that I can take tissue pull down so that skin locks right over where I want to be. In this case, I'm going to take that right hand contact. Just realize on the other side, since this hand's not free to take out the tissue slack, I know that the TVP is on the adjacent side over here, so I'm going to start this thumb contact a little bit inferior so I can take that tissue pull so that I can lock up onto this. From here, I want to get my body weight balanced between my two hands because I'm going to use my body weight to do this. I'm going to come off the spine and say that this is more like a corkscrew. As I lean into the body, I'm also going to torque counterclockwise, and you're going to feel the joint give, and then set. From here, once I got pretension, I'm going to continue leaning in and torquing through the joint to feel end feel. So it's going to look like this. And then vice versa for right lateral bending. The other contact points we showed you to use are more traditionally adjustive contacts. If you choose to take them, the general rule is as follows. Whichever side you're standing on, it doesn't make a difference. The contralateral side of the body is you're going to use a thenar eminence contact. Ipsilateral side, you're going to take a soft pisiform contact. So once again, let's say I want to create left lateral bending. Because on this side I want to come I to S, I'm going to use my inferior hand. Because I'm on the contralateral side of the body, I'm going to use my thenar contact. I still have to take tissue pull into account, so I'm first going to find this TVP. With my non-contact hand, I'm going to take tissue pull up to this contact. From there, I'm going to replace it with my thenar eminence. This is where I'm going to be weighting my hand. This is where I know that the TVP is on the other side adjacent to it. This is where I want to feel the weighting of my pisiform contacts. When I lock down taking tissue pull, I want my soft pisiform contact to be at the same level. Your hand should virtually look like this. If your hands look like this or your hands look like this, you're obviously not on the same level. You're on two adjacent segments. Once I have my hand contacts here, once again I'm going to balance my body weight between both hands. I'm going to lean into both hands as I begin this counterclockwise torque, and you feel the body give, and then set. From there, I'm just going to spring through that same corkscrew motion to feel end feel. And that would be, in this case, left lateral bending of the thoracic spine in a prone position.